I should probably start my video with this is what I've looked like over the past 2 days. Barely able to move or get out of my chair. But now I am on the rise again. All right, today is Tuesday, February 25th, 2025, and I think I'll post it today, maybe more in the evening or late afternoon. So you'll either see this Tuesday or Wednesday or whenever you see it. This is my weekly update for how I'm doing. And in case you're just following me, I've been on hospice for about 3 months now. So for my weekly updates, and you might be noticing I'm pausing to take a little bit more breath here and there. I do 5 things. First, I jot down my notes. Then I talk about how I feel. Then I talk about the data, because how I feel and the data may or may not correspond with each other. And then I compare and contrast how I'm doing in the past. I've done that with just the 6-month checklist. But today I'm going to compare and contrast the 6-month, the 3-month, and how I'm doing checklist of how long people have to live. And then finally, I wrap up with like a conclusion and what my next steps are. Now with that said, these are just educated guesses. That is all that they are. One of the things that really became clear to me and my family is that even though I have this idea in my head and we have checklists and there's a general understanding that with breast cancer the decline is a slow downhill, and so in my head it was like, okay, it's going to be slow downhill. Once I can't take care of myself or do my medical things anymore, I'll go to the Pearl and Elgin and nursing home. But even though I have that in my head, B, C, D, E, F, G could happen. And so these, again, are just educated guesses. I could have a heart attack. One of my other organs could fail. So, there's that. One of the things that my husband and I talked about, and my roommate and I talked about, and eventually we'll need to talk about this with other people who are around me, is when do you call hospice and when do you call 911? So it was really interesting. My husband and I were talking about this Saturday morning. And if I have a heart attack or break a bone and it's an emergency, I can still call 911. But if it's not an emergency and it's related to my cancer, I need to call hospice. So this past Saturday, I heard and felt a small pop in my left chest, and then I felt a surge of pain. So I was looking up the symptoms for a heart attack, and I only had one of them, which is like a sudden sharp pain, but I didn't have anything else. I wasn't sweating, I didn't have a fever, there was no technically sharp pain in my arms or anything like that. So instead of calling 911, I had my husband call the hospice. So they were able to get to us in a few hours. And even if I was to drive to an emergency room, it would probably take that long anyway. And they actually come to my house. I don't have to go anywhere. So that's awesome. They said that I should take morphine every 2 hours, which I started to try, but it didn't really do anything to alleviate this new pain in my chest that I have. And I know you're not supposed to Google this, but I Googled what it could be anyway, and I think I found out what happened, although I can't be 100% sure because I'm not really doing x-rays or anything at this time. But it matched all the symptoms that I have. It's called costochondritis. Costochondritis. Okay, so anyway, That's an inflammation of the cartilage that connects the ribs to the breastbone. And sternum is where a lot of my, not just the breastbone, but also the sternum. And that's where a lot of my cancer is. The pain it causes can mimic that of a heart attack. It also happens in women on the left side of their body, which is where mine occurred. And it causes pain when taking deep breaths or coughing, which mine does. And I will add, laughing too hard can be very painful. It kind of feels like I've had a surgery, so I'm treating it more like that because the morphine was making me feel sick, increasing it to 2 hours. Sunday, I spent most of the day in my chair sleeping, and yesterday, Monday, was actually pretty rough. I'm not sure what happened, if in conjunction with this snap and pop, if I ate something bad the night before, if there was just too many drugs in my system, if it was a combination of things. I was feeling pretty nauseated, and at 12:15, I took my anti-nausea medication, and around 12:30, I tossed up all my cookies, or apple salad in this case, that I had in my system. That's the first time I've actually thrown up while being on hospice, and luckily I didn't do it again. So I had been resting all day, and I had a follow-up appointment with a nurse who came to check on me from Saturday. I liked him a lot. His name was Eddie. He had a really good energy. And we talked about me not really wanting to take as much morphine. I'm not against it, but that increase obviously made my system sick. So I'm just using other strategies. Like I brought down my heating pad and I put it on the sore part of my chest. That actually really helped a lot. Using a pillow or even just my hands to hold the area when I cough or laugh, so people might see me do that. And then I stopped taking morphine until about 1 a.m. this morning. Just to give my body the chance to detox a little bit. Also, I did have oxygen delivered to my house in order to be more proactive rather than retroactive. Meaning that I'd rather have it in my house when I feel out of breath and have it on hand rather than feel out of breath and have to wait for a few days or hours to get it. I've been feeling out of breath, mostly going up and down the stairs, but I can get winded doing other things. Like even during my shower today, there's a time I had to kind of like kneel down or sit in it for a little bit. It almost seems to me like that snap and pop that happened on Saturday took me down like, I don't know, a month or whatever. It just made things that much harder within seconds. So that's kind of interesting. I'm really definitely at a turtle pace at this time. The guy who delivered oxygen and trained us was really nice. He was funny. So today I kind of want to organize where might be the best place to keep it. It's kind of interesting. You have to have this sign on your door somewhere. So that there's no threat. Like if you have a fire in the house, I guess, yes, it could technically explode if the fire gets near it. Or another thing that could happen, it has so much PSI in it, it can act like a rocket, and I guess it can go through brick walls. So don't put it in the trunk of my car, and keep it in safe places. So that's kind of interesting. At least this morning, I seem to be on the mend. My brain and body still don't feel 100%, but there's definitely a positive progression for sure. And I think, like all aspects of my life, I like to blend more natural calming methods with the Western methods. I don't think taking the morphine is good for me every 2 hours. The pain that I have in my chest, I can handle with rest, massage, and just holding the spot when I cough or laugh. So now on to the more objective data that the nurses gather when they are here. And I actually had 2 appointments, one on Saturday and one yesterday, Monday. My blood pressure on both days was a little bit high. On Saturday, probably because I was feeling pain for a few hours, and Monday, probably because I still wasn't feeling very well. My temperature has always been normal, so that's good. My pulse is always a little bit low normal, which might be expected at this time. My respiration rate is constantly high normal, which again makes sense with the lung issues I'm having. But even with that, what has been consistent and which is still good is that my oxygen saturation is still pretty good, all things considered. So again, I did have the oxygen delivered to my house, and I might experiment using it once in a while when I am out of breath. I talked about weight and BMI last time. I don't think I'm going to talk about this time because I don't really have a new number. So I'll only talk about that when I have a new number. All right. So now that I've been on hospice for 3 months, I'd like to start comparing and contrasting the 6-month and the 3-month checklist. So at the 6th month, I should be able to care for myself. At the 3-month, I might need assistance with self-care. How I'm doing. While I can still take care of myself for the most part, I do need some assistance at times. Like someone bringing down the laundry basket for me. And if I'm trying to adjust how I've done some things in the past to reduce stress, like on that sternum area. For example, like my medical things, I had to lie down for that and almost do a push-up in the morning. And so I'm trying to see if I can do it sitting up at this point. At the 6th month, I should be able to perform small tasks and chores with fairly good energy. At the 3-month, I would need assistance with small tasks and chores, and I would have lower energy. How I'm doing. The past 2 days have been abnormal for me. I was barely able to get up out of my chair, and my current energy is somewhere between 6 months and 3 months range. Appetite decreases at the 6 months to about, these are not exact numbers, and in fact, I will be honest, these are numbers I've made up based on just my own experience, okay? So appetite decreases, maybe you might be eating 1,000 plus calories per day, and around the 3 months, appetite decreases, maybe you're eating 500 calories or less per day. I'm still somewhere between 500 and 1,000. The days where I felt nauseated or not well, I was probably closer to that 500 or less. So again, I'm somewhere in between the 6 and 3 months. With 6 months, you might have some difficulty chewing or swallowing dry things. And then at the 3 months, you might have difficulty swallowing even non-dry foods. And so mostly I have difficulty swallowing dry things, although last week I said I had a little bit of difficulty swallowing 2 other different kinds of foods. At the 6 months, your cognitive abilities are intact. At the 3 months, they start slowing, and you might even see some disorientation or confusion. Last week, I stated that my cognitive abilities were intact. The past 2 days, my brain felt so slow that I couldn't even have the energy to play my silly games. So there are like blips in my energy and my cognitive abilities. Also, I've been I've been experiencing at times, I'm going to call it Jenny consciousness and Jennifer consciousness. So Jennifer consciousness is on track of things. She checks her email every day. She writes a schedule for herself, is able to keep up with her own schedule, which is basically just taking care of myself at this point, because it took me 3 hours to get ready today. But anyway, there's that. And she sounds more wise or whatever. The Jenny consciousness is more like the child inside of me. And the way, I can't remember, I think the movie was called Split. It was about a man who had multiple personality disorders. But I thought that the way that they showed that was really interesting. He had like different personalities like on a chair, but in the middle of the room there was a spotlight, and then the person who was in the driver's seat was in that chair. Well, sometimes when I'm on my drugs and stuff, I feel like Jenny, and she's a lot more childlike. And now my son says I'm like that all the time now, but I think he's around me less than other people are. So sometimes I'm still Jennifer, and there were other times, even before hospice, I get kind of Jenny-like. When I get tired or whatever, I get kind of goofy like that. But you might see it a little bit more now that I'm on hospice. So it's me. And the other thing too is I've had 12 years to go through the grieving process, and so I'm at acceptance, where I realize some people might be at the beginning or middle of this process. So sometimes I even make like jokes, and I think they're funny, and other people probably don't. So that's also kind of the Jenny consciousness too. At the 6 month, little to no sign of social and or personal withdrawal, able to still get out a bit. And then at the 3 month, there is increased signs of social and or personal withdrawal. As you start getting closer to the end of life, the first thing might be becoming homebound. So I have decreased going out, especially at night, and I am having groceries delivered more and more, and I probably am a little bit more homebound now. Other symptoms I went through at the beginning of this video. So what I'm taking from this in conclusion is that I'm somewhere between the 6 and 3 month timeline. And again, that's not an exact date. So I probably have about 4 or 5 months left. And again, as I said, B, C, D, E, F could occur too. These are just educated guesses. So the upcoming plan is to just go with my energy and flow, do what I can do when I can do it, even if that means doing things a little less. The other thing that's new this week that we've put in place is that my husband goes to work in the morning, and then during his lunchtime, he comes home so he can be here for me and helping with some of those things that I might need in the afternoon. Also, trying to make those phone calls and creating a stable environment for my family, and still trying to visit or have people visit or call people. Again, that's kind of difficult because I don't know how I'm going to be feeling. Like the last 2 days, I was basically in bed all day, but today I'm up and about, so, but it takes 3 hours to get ready instead of 2. I'm going to keep working on my social media posts and my writing when I can. And the point is that I still do have some time. And even if the path of the journey is a little bit shorter, there's still a lot of living to do and some good stuff to leave behind.